It's very hard to diagnose it. The gold standard is a inpatient sort of outpatient, whatever procedure where you do endoscopy and put a tube into the small intestine. That's the way it's done in studies to, gold standard, but that's not practical for normal circumstance. So then we have three options. You can do a urine organic acid test, and that does not differentiate between small and large intestine, but that's okay. It will let you know if there's an overgrowth of yeast in the intestinal tract, small or large. When we say SIFO, the SI stands for small intestine, but that's sort of our new thing, is to realize that yeast overgrowth can occur in the small intestine. Always we thought of it in the large intestine. So it can be anywhere, right? In the intestines. Second would be a stool test. That's only going to show you if you have it overgrown in the large intestine. And third is a blood test. It's the Candida antibody antigen immune complex test. And that checks if your immune system in your body thinks there's a problem with yeast. There may not actually be an overgrowth, but your immune system has decided it is upset about whatever yeast is there. There might be an overgrowth. So that would also be another test. And I typically would run 2, if not all 3 of those tests, because people were coming to me wanting a diagnosis. So you have to decide where you're at, what kind of money you want to spend. Some people hate when their doctors want to run lots of tests. Other people are like, why won't you test me? So there you go.